I think this is obviously a big topic for the last year and a half now. So for us at MD Anderson, when our first patients were coming into the hospital with COVID, disproportionately, it was a lot of our myeloma patients. Obviously, we know now there's a lot of reasons that happens. And unfortunately, a lot of my patients were getting really bad pneumonias with it and dying. We were trying all kinds of therapies like steroids and tocilizumab and different ways of intubation, et cetera. And I think the nice thing is now we have an algorithm for patients who really come in very sick, putting them on antiviral medications and steroids and giving them IVIG, giving them the COVID antibody, sort of all at once at the beginning to really prevent, the further inflammation that causes other symptoms down the road. The other great news is that just last week I was on our CAR T service and I get to see the inpatient service for the COVID unit, kind of the numbers for our department. And before, in the last, 2020 and 2021, we had about 5 to 15 patients usually every day on the COVID unit from just our department. And last week we had 0 for an entire week. It's gone back up to 1 or 2, but really I think these vaccines have made a big difference already. I know a lot of patients and physicians are worried that some patients who are really, immunosuppressed and have had a lot of treatment, for instance, their lymphocyte counts might be low, their globulins, IgG levels are low, so they're not sure they're going to respond to the COVID vaccine. But I can say that at least the majority of patients seem to be doing better because of the vaccine itself. I think there's more things coming down the road as to what do we do with patients that might not respond to the vaccine, that are extremely lymphodepleted. Will there be boosters for patients who get CAR T, for instance? Our institution is trying to do that if you get vaccinated now, but then you get CAR T therapy and you get lymphodepleted, well, maybe 3 months after we can do a booster. Same thing with stem cell transplant in our myeloma patients. We get the vaccine now. What do we do after? So as we go, more things that, we'll learn and make sure our patients are protected.